And we're really excited to be here today. Many of you, or most of you, have likely heard of the expanded child tax credit, through which families can get thousands of dollars. And we know with high prices and the ongoing pandemic and back to school expenses, this money can go so far right now to support families. And today is really important because we have really an urgent and time-sensitive opportunity to help families get this money before mid-November, when what's known as a simplified filing portal, getctc.org, will close. And GetCTC really represents an easy and quick way for families to go ahead and claim the money to which they're entitled on their own. My colleague Itin will share more later about how families can continue to get this money even after November. But we really want to focus the next 2.5 months that we have now on making sure we get as many families to get this money right now. And after we do our presentation, we're really lucky to have two guest speakers, Monique and Yesenia, who I'll introduce later, who are doing really wonderful outreach to come here and share so you all can get outreach ideas and inspiration. And we'll have plenty of time for question and answer at the end in a live Q&A. But if you have questions throughout, we'll do our best to answer, and you can go ahead and put those in the Q&A function. And so with that, I'm going to pass it over to Itin to get us started.
Great. Thank you, Julia. And again, thank you everyone for being here today. I'm very excited to talk about some updates on the CTC and share great info from our guest speakers as well. Reminder again, all of this will be recorded and you will get the slide deck as well as the slides and links to all the resources that we mentioned in a follow-up email after this webinar. And so welcome. As always, we want to emphasize in our presentations, our aim is not to make anybody a tax expert. We just want to make sure that organizations, providers, anyone doing this outreach is aware and has clear information on the expanded child tax credit and how to connect families who possibly still haven't received their child tax credit, haven't received the second half, and send them in the right direction to do so. So many of you are familiar with us, but just a quick refresher. This effort is a joint partnership between the Coalition on Human Needs and the Partnership for America's Children. The Coalition on Human Needs is an alliance of national groups that includes service providers, faith groups, policy experts, and other advocates, and whose mission is to advocate at the federal level to meet the needs of people with low incomes and increase knowledge of positive outcomes from current or proposed programs. The Partnership for America's Children has over 50 members of multi-issue child advocacy organizations across 40 states. Their mission is to support its network of state and community child advocacy organizations in effective advocacy. So what is the expanded child tax credit? We just want to do a quick review, refresher. We know that many of you have already been doing this work for a long time, but in case anyone is new to these outreach efforts, just a little refresher on what the expanded credit actually is. So the 2021 expanded CTC meant more money and more families eligible for this money. So the CTC was increased from a $2,000 credit to $3,600 per child ages 0 to 5 and $3,000 per child ages 6 through 17. There's no minimum income requirement, so families with no earned incomes are eligible for the full credit. And the credit is fully refundable, meaning families are eligible for the full amount even if they don't owe taxes. And families were eligible to receive half of the CTC in 2021 through advance payments, half when they filed their taxes, the second half when they filed their taxes this year during tax season, or the full credit amount if they hadn't received advance payments in 2021. So we always like to share this example just to illustrate how much money is actually at stake and on the table for families. So if we were looking at a family with 3 children, a 2-year-old, a 4-year-old, and a 7-year-old, in total, that family would receive $10,200 in the 2021 CTC credit. And in addition to this, this family might also qualify for additional money through stimulus payments they might not have received and other federal or state tax credits. So it's a lot of money, and it can be really impactful for families who qualify. And who is eligible for the 2021 CTC and how do they claim it? So adults may have a social security number or an individual taxpayer identification number, an ITIN, but all children must have social security numbers, and those social security numbers must be valid for employment. The dependent must be the adult's child, including adopted, grandchild or stepchild, younger sibling, step sibling, half sibling, or their descendant, or a foster child placed by a government agency. The dependent must have lived with the adult in the US for more than half the year. There's some exceptions, like babies born in the second half of 2021. But essentially a child has to have lived, and it doesn't have to be consecutive, for 6 months and a day with the adult that is claiming them for the CTC. The dependent also could not have provided over half of their own support in 2021. And speaking a little further around specifically ITIN applicants. So as we mentioned, adults with social security numbers or ITINs can claim a child for the CTC if that child has a social security number. In the post-tax season time, in the post-2022 tax season time, if an adult has a current ITIN and they haven't yet filed their taxes and received the CTC, they can still file to claim the CTC and potentially other credits. If the adult has an expired ITIN, they can still claim the 2021 CTC by submitting a Form W-7 to renew their ITIN and filing a tax return. We have a link here from the IRS. Again, we'll share all these links as well with you for further information for adults who have an expired ITIN and would like to claim the CTC and haven't yet. Unfortunately, though, if an individual has never had an ITIN and they did not apply for a tax filing extension before the end of tax season this year, they can no longer claim the 2021 CTC. They can still apply for ITINs to file taxes and potentially claim credits in future years, but unfortunately, they can't claim the expanded 2021 CTC without that ITIN having already been in effect or with a filing extension before the end of the tax season this year. So tax day has passed, but families can still claim the CTC. This is a big emphasis of our webinar today. We really want to share that information with you and just really emphasize that outreach is still critical and important for the many families who have yet to claim their CTC. So individuals with no or low income can generally still file for a tax return past the end of the tax season without a penalty. If someone was required to file, didn't file, but would have been due a refund from the IRS, they can also still file without penalty. Individuals also have 3 years to claim any tax credits that they are owed. So this means that the 2021 expanded CTC is on the table for families to claim through tax season 2025. And our big push right now is getting people on Get CTC while that's open, but even past Get CTC for families who aren't eligible to use Get CTC and would have to do a full return, that's possible through tax season 2025. And we'll talk a little bit more about that as well. And we also want to add that for individuals who are worried about filing because they owe the IRS, you know, they could owe back taxes or maybe owe child support, it's still worth filing to help pay off their debts, because essentially if they qualify for the credit, what they're eligible for can go towards paying off any debts that they owe to the IRS. So getctc.org, what is it? It's a simplified filing tool that helps you claim the CTC and the third stimulus payment. It's IRS approved. It's an IRS approved official e-file provider created by Code for America. It's available in English and Spanish. It's mobile friendly. There's chat support available, and it will be open through mid-November of this year. Who can claim the CTC using getctc.org? So for a family or an individual to be able to use the simplified portal, they have to not yet file the 2021 tax return. We know that there might be some people out there that perhaps filed a tax return, didn't know they were eligible for the credit and didn't claim it and would like to amend and get the return. Those individuals can't use GetCTC. They would have to do a full tax filing. They have to have made under $12,550 if they're filing as single, or $25,100 if they're married filing jointly for tax year 2021. They have to have earned less than $400 in self-employment income. Again, they must have a social security number or ITIN, and the children must have social security numbers. They must have lived in the 50 states or DC or on a US military facility. And they did not have or receive advanced premium tax credits. These are the credits received towards towards lowering your monthly health insurance payments. That does not mean if they receive the advanced premium tax credits that they're not eligible for the CTC. It just means that they can't use the Get CTC portal. And we're not going to go through the demo video today, but Get CTC has a great demo video that walks you through the application. We'll share that link as well. If you haven't seen it before, it's a great tool to get you acquainted with Get CTC. So now I want to speak about who would need to file a full tax return, and just go over some resources that can be available to help families file full returns now or in the next tax season. So if individuals made above the filing thresholds that we talked about are eligible for additional money through full tax filing, something like the earned income tax credit, or received the advanced premium tax credit, Get CTC will direct them to its partner website. That means somebody who may not realize that they can't go through Get CTC can go on Get CTC, go through the screening questions, and then be redirected to getyourrefund.org to do a full tax filing. And so on getyourrefund.org, individuals can identify local VITA sites for people to file a full return. At this time, many of the VITA sites are closed, so we encourage anyone who locates a VITA site in your area to please call ahead of time to make sure that they're open and can assist you. For married couples, both partners do have to go to these appointments. VITA sites, if open, some can actually help with amending taxes. So again, for anyone who perhaps already filed their 2021 tax returns and didn't claim the credits, VITA sites can help. You just have to check ahead of time. Not all VITA sites can do it, but you just want to ask ahead of time if they're available, if that assistance is available. All sites will reopen in late January for assistance through tax season. Getyourrefund.org also has access to free do-it-yourself tax filing services. So if somebody is comfortable filing their taxes on their own, that's available through getyourrefund.org as well. Again, this has some limited capacity right now, but there is free virtual tax filing assistance that includes being able to speak with somebody over the phone about your return. We also want to include these couple other resources that can be helpful as well for full file returns. The first one is the Aarp Foundation tax aid sites. These are only open during tax season, but they're another resource to help individuals who are over 50 and have low to moderate income to complete their taxes. We also have the low income taxpayer clinics, or LITCs, and these can help individuals with low incomes who have disputes over who is claiming the dependent child on the tax return. So that's a great resource if there's any sort of situation on who has full custody of the child and who's actually claiming the credit on a return, to help people navigate that situation. And also, we know that some people will have to go through paid tax preparers when the time comes. We have a great resource here also from the IRS on some guidance on what individuals can ask or check for before signing up for an appointment with somebody that they will have to pay to file their returns with. So just to make sure that everyone is getting high quality, reputable tax assistance. And we also want to include some information on an additional benefit that many families who we're doing this outreach for could also qualify for. So this is another resource, not attached to tax returns, but we find could be really beneficial for families out there, especially low-income families. And that's the Affordable Connectivity Program. So this program, individuals are generally eligible for it if their household income is under 200% of the FPL, or the federal poverty line, or if they have someone they live with that currently has different government benefits such as SNAP, Medicaid, WIC, SSI, a Pell Grant, or free and reduced price lunch. And the benefit includes up to $30 a month discount on internet services, or up to $75 a month discount if the household is on qualifying tribal lands. And there's also a one-time discount for up to $100 for a laptop, tablet, or desktop computer. Link there as well for the information. We just wanted to include this because we know a lot of you are providers or organizations that house providers, and always looking for different resources to share with families in need. And this is another great program we want to make sure you have information on. And so now I just want to speak quickly about child tax credit outreach and some of our findings, and what has worked for ourselves and has been shared to us as having worked for our partners. So outreach that is integrated into existing programs and communications has been found to be really effective, as well as providing families with multilingual information multiple times. Outreach should include clear information on how to claim the credit. So, flyers or text messages to direct people to getctc.org, for example. And also, many families will not need additional assistance filing after they are directed to getctc.org. So it's not necessary to perhaps schedule an appointment for somebody to be assisted to walk through getctc.org, although having that additional assistance available when requested is great. A lot of families, once they get the information, the link, they're able to navigate through the site with ease. Also, school districts and government benefit agencies are among the most trusted sources of information for families. And we really want to emphasize this point because school districts and agencies are really well positioned to spread the word as trusted messengers that regularly communicate with families. We've been partnering with different organizations like Code for America to encourage school districts and agencies to text or email families or distribute flyers a few times before the November deadline. My colleague Julia is sharing a short form right now in the chat. If you can, please fill it out to share about any sort of CTC outreach you've done with schools or agencies, or let us know if you have school or agency contacts that you can put us in touch with to expand our CTC outreach efforts this fall. Additionally, text messages, for example, from schools, as I mentioned, or agencies have been especially effective, although robocalls, emails, and mailers can also be effective. In addition to hearing from trusted community messengers, it's important to note that families may also need to hear from tax, immigration, or family law experts for their particular cases or situations, if they have questions come up that might affect them, or they have concerns about if they do claim the credit. And we recently launched a new website. It's childtaxcreditoutreach.org. On there, you can find all our resources and toolkits, any sort of upcoming open to the public presentations such as this one, as well as previous webinars and recordings that we've done. We also have a great new section that includes a weekly blog that we share out through our listserv, as well as on the website, about the most up-to-date information that's impactful for anyone doing outreach in the community. We also have 4 different toolkits available at this time. All of them as well are linked within our website, but they have these individual links as well. So we have one for partners, we have one for public agencies, we have one for families, and we have one for schools. And once you have the link, if you're either going through our website or through these links that we're sharing, you'll have the most up-to-date information. We keep all our resources as up-to-date as possible. So once you have access to it, you'll be able to have access to all the things that we're updating on a constant basis. And this is just a list of some of the different resources that are in our different toolkits. There's resources for immigrant families. There's some best practices and lessons for child tax credit outreach, an expanded version of some of the things we've talked about, a report on lessons learned about benefit agencies and school outreach, flyers, posters, and much more. This is just a quick screenshot of some of the different resources we have up there. And now I'm going to turn it over to my colleague, Julia, for the second part of our presentation.
Awesome. Thanks so much, Alini. And I'm going to have to share my screen here, which might mean going through the slides very quickly. But while I'm doing that, we're so glad to have been able to do that quick recap of the CTC. And now we want to spend some time figuring out how do we actually help families get this credit. I'm multitasking less well than I hoped I could. So let me just quickly get over to the right slide. And so Alini shared some of the resources that we have, ideas for doing outreach. One of the things we've noticed is that there's so many people at risk of missing out on this credit that we have to get very creative in our outreach. And we know that there's not just one outreach strategy that will work for everyone. We know that sometimes what we need is, all right, here we go. Sometimes what we need is that high volume outreach, what we've been seeing with agencies and schools, as Alini mentioned, that's so effective, communicating with tens of thousands of families at the same time. And we know that for some families, they do need a little more of that one-on-one support. They have questions and concerns. They have not yet gotten it, and they need that support. And so we have two really wonderful speakers here, Monique and Yesenia. And I think as they're speaking, you'll see both of those approaches really reflected and represented in what they're sharing. And after they've spoken, you'll have plenty of time to ask questions in the chat or live. So I'm going to go ahead and introduce our first speaker, who is Monique Fraser, who's program manager for tax and income support at New York City Health and Hospitals, which operates public hospitals and clinics in New York City. And it's the largest municipal healthcare delivery system in the country. And I've gotten to hear a little bit about Monique's wonderful work and our team's work, and I'm so excited you can be here today to share a little bit about your experiences with CTC outreach.
Thank you, Julia. Happy to be here. Hi, everyone. My name, again, is Monique, and I am with the New York City Health and Hospitals Corporation, New York City. So next slide, sorry. So just before we get into like our different outreach strategies, I just wanted to share a bit about our hospital system. So we are the largest safety net healthcare system in the nation, and we currently operate 11 acute care hospitals and over 70 health centers. And each year we service around 1 million New Yorkers annually, and we service pediatric and adult populations. So I am a part of our social determinants of health team, and that actually sits in our Office of Ambulatory Care and Population Health. And we're a team of people who really try to address our patients' social needs, some of which include food, legal services, housing, and increasing access and enrollment for public benefits, because we hope that this will lead to positive health outcomes for our patients. Sorry, next slide. So we thought it was very important to promote the CTC and the Earned Income Tax Credit, because we have various touch points with our patients. We can meet them through doctor's visits, follow-up appointments, and other forms of outreach as well too. So we actually partnered with the New York City Department of Consumer and Worker Protection, and that's an agency in New York City who developed the Office of Financial Empowerment. And what they do is that they partner with a number of different community-based organizations throughout New York City to provide free tax prep services. So we were actually able to partner with them during the last tax season, where we were able to co-locate our tax prep services within 8 of our facilities here at Health and Hospitals. But we thought it's important that we can do great outreach because we really wanted to engage our families with newborns, which was around 12,000 newborns last year. And then also non-pilot families with children served within our healthcare system, specifically the pediatric department, and that's about 17,000 patients. And again, the goal is really to increase like positive health outcomes for our patients. Next slide, please. So the first method of outreach that we utilized to promote the CTC and earn income tax credit was using the pediatric after visit summary. So the after visit summary is a recap of what happened with the patient and their provider during their visit. And from the beginning of the tax season, which I believe was the last week in January up until April 15th, we actually had 95,000 pediatric patients who had a scheduled visit with a provider. So each of those 95,000 patients were actually able to receive the information regarding the upcoming tax season within their after visit summary. So we made sure that we included the different credit amounts because we think it's important that people know how much money is available to them. And then we also included a link and a QR code, and that linked back to the New York City Department of Consumer and Worker Protection's website, where patients will be able to get more information as well as schedule an appointment with the tax preparer. Next slide. Our second method of outreach was actually to use MyChart. And MyChart is basically the patient's electronic medical records, and they're able to access that through a browser, or they will be able to download an app to their phone. And it really provides them with direct access to their healthcare providers where they can send them messages, schedule appointments, reschedule appointments, and also send messages to their care providers as well too. So we were able to put a passive notification in the patient's MyChart, and we also included a link for them to find so they can gain more information about where to file their taxes. And this link also linked back to the New York City Department of Consumer and Worker Protection's website so they could find out more information and again, schedule an appointment. And the patient actually had the opportunity to engage with this link as many times as they wanted to until they clicked the dismiss button. So during the tax season, we found that 84,000 patients were able to engage with this link and learn more about free tax prep services. Next slide, please. So again, like I mentioned earlier, we actually partnered with DCWP to provide free tax prep services at our health and hospital facilities. And what we did to promote those services were we hosted staff-wide trainings. So providers would be aware of the services that were being offered and like how to discuss them with their patients. We also distributed flyers. We put the information on our intranet. We also sent out information to our social determinants of health listserv. And then we also attended different departmental meetings just to provide awareness around the upcoming tax season. And then we also included flyers in our aftercare packages with New York City Test and Trace. And that went out specifically to individuals who were suffering from long COVID. Next slide, please. So some of the primary challenges that we encountered during the season was nationwide that there is a shortage of certified IRS FIDA volunteers. So we just didn't have people registering or becoming certified to provide free tax prep services. So it was hard for our CBOs to actually staff volunteers on site. And also we had the Omicron surge, which happened like in December. So we actually found a way to pivot to virtual services at 3 of our locations. But then also like the IRS they don't publish data or research on people who use like FIDA services. So it's really hard to understand the demographic that utilizes these services and also how to reach them. Sorry, next slide. So just wanted to share the impact of our co-located services. So again, like we provided services at 8 facilities and we were able to serve 1,320 filers with the help of our 3 CBOs, which where Grow Brooklyn, Urban Upbound, and Bronx Works. And in total, they were able to receive $2,035,626 in refunds and tax credits. So the average total refund per filer last season was $1,542. And CTC eligible filers were able to receive an average credit of $1,691. And those who were eligible for the earned income tax credit were able to receive an average credit of $976. Sorry. So that is like a complete overview of the outreach that we did during the season. And also in terms of promoting the Get CTC portal, we were able to, again, share that link with our Social Determinants of Health listserv. And then we were also able to put that information on the Health and Hospitals intranet.
Awesome. Thank you so much, Monique. That was wonderful. And I think over $2 million, if I read that right. So really an amazing effort. So I'm sure folks have questions or want to get in touch with Monique. Monique, perhaps you can share your email in the chat, or I can do that after. Feel free to put questions in the chat and Q&A, and then we'll also have time for a live Q&A in a moment. And if you want to learn still more about this, or even take these best practices and share them, we will have a blog coming out about the work of New York City Health and Hospitals in the next week or two, so stay tuned for that as well. So I think Monique gave us some really wonderful ideas for folks who are in a position to communicate with thousands of folks through email or text or website. Obviously, this was in a medical setting specifically. And now I really want to welcome our second speaker, Yesenia Sanchez, who I think is here. Yesenia, if you want to, there you are, perfect, welcome. So we're so excited to also have Yesenia here, who is program supervisor with Casa Familiar, which is a service and community development organization in San Ysidro, California, which engages families through education, advocacy, services, housing, and community economic development. So Yesenia, I know you and your team have done a lot of great work as well, so take it away.
Hi everyone, thank you for having me. So I oversee the Financial Opportunity Center, where we help with finances, we help with employment and income supports. That's just my department. Casa Familiar has a lot of other services like immigration, domestic violence prevention. We have environmental justice programming, a lot of things that we saw the opportunity to do a lot of our child tax credit outreach for. So one of the best practices that we had was to really incorporate it into all the programming that we do. And it would be something as simple as like providing flyers, sharing the information. And then because we do have a tax team that works in our social services department, we were actually able to help with not only the toolkit, but also preparing the taxes during tax season. We did do them year round, and we continue to do the outreach for it. So it's really just like continuing to provide that information and then helping them through the process, because we are one of the bigger like CBOs in San Ysidro, which is like 5 minutes from the Tijuana-San Diego border. We had a lot of people who would like just trust the organization, so they would come in just for basic screening and things like that. What we did is one of our, I feel had the bigger impact was really relying on our reception team, our tax team, to give information. So because we do receive a lot of phone calls about random, well, not random services, but all the services we provide, we would have reception ask at the end of every call, like, hey, have you heard of the child tax credit? And if they did, then we would either like schedule them an appointment to see if they got the remainder of the credit or if they're missing anything. And if they hadn't, then we would kind of explain it to them. And then they would be like, oh, like either I qualify because I have children under 17 or I don't. And then in that case, we would just help them out with whatever they were initially calling for. Another good thing that we did was we implemented it with our San Diego Promise neighborhood team, which they are in the school. So everything from like elementary up until high school, they help provide services and really connect the community with resources. So it was one of those things where they would go to the promotoras, which they already have trust in. And then they would be like, hey, so our Financial Opportunity Center is also helping with this. And then that's when we would give them the option to either schedule just like a quick little check-in with us so that they can see if they qualify for the service. And because they are like K through 12, it was obviously the families who would qualify. Some of the issues that we did see was like custody issues, like if they had a 50-50 parenting situation, like who would claim them. And like the Itin support, we also help with that process. We would also get a lot of like, will it affect my benefits? Because we do also do like income supports, like food stamps and Medi-Cal. They were kind of like hesitant to apply just because they were like, oh, if I put this as income, will it affect it? Like, I don't want to lose my CalFresh just for like a one-time check. So it's really like giving them the reassurance to actually apply, letting them know that it wouldn't count as income to specifically San Diego County, and things like that. Another big thing that really helped too was when we got the social media postings for it. So we were able to then share it on our social medias, and then we would have people like DMing us, sending us like swiping up on the stories and being like, hey, like what is this about? And then we would then in that way be able to provide more information. So it was really like grassroots efforts. Social media was like our bigger scale one because we were able to reach more people. And along with incorporating to all of our programs, like even if our environmental justice program didn't know so much about CTC and what you needed to qualify, then it would be more like, oh yeah, like, hey, I can refer you to Yesenia. She'll let you know like what best practices are for it, what it takes to qualify. And in like really designating the team that was like the CTC experts, I feel like that really helped the whole organization be able to do outreach, even though it was just like specific, like 6 to 10 people who would be heavier focus on it. And among with all those programs that we have, and with the child tax credit, we actually helped one of our transitional housing participants, and they went from like being in a previous domestic violence situation to going into our transitional housing for a couple months. And with the case management that we were doing throughout her stay, she was actually able to claim the tax credit, and she had never in her life claimed taxes before. Like she never did them. So we were like, oh no, like you're still able to do it, like it's fine. So she was able to get this child tax credit and her stimulus for her daughter. And with that, once they finally finished the program completely, then she was able to then furnish her new apartment, which is really nice to hear that she was able to like, she had that unexpected money because she didn't know about the child tax credit, and now she's able to use it to like help her daughter feel at home. And now they have like a good place to stay at. They have continued support with us, even though they did end the program, but it's really connecting them to all the resources that they really qualify for, including child tax credit, and sharing all that information with them so that they're aware of what's available to them. And yeah, I think I might have gone a little too fast, but that's pretty much the spiel of how we did our outreach at Casa Familia. Julia, we can move into questions if you're ready.
Perfect. Thank you so much, Yesenia, and for sharing. It's numbers are important, and hearing stories is, I think, especially impactful. So grateful for your work and all the ways you were able to integrate CTC outreach into your ongoing work. So a big thanks to Monique and Yesenia, both for taking time to share here and for all of your work. We're going to go ahead and move into the question and answer. Here's my email and Alini's email for those who have questions, and we can also share this in a follow-up email. And so I'm going to go ahead and open it up if people want to put questions in the chat or the Q&A. And if you would like to answer your question out loud, you can go ahead and use the raise your hand function, and it will allow you to unmute. And feel free to also direct questions at Yesenia and go ahead and stop sharing now. So I see someone has raised their hand. I'm going to try to mute you. Okay, I think Genesis, you should be able to unmute yourself if you want to go ahead. did you have a question? Okay, well, feel free to jump in if you do. Any other questions?
While we're waiting for questions, I do want to highlight one of the questions that went in the chat and that we answered, which is the nature of the relationship between the caregiver and the child. That people who are caring for a child for more than 6 months in a year, but who are not the child's parent, can still claim the credit, but they do have to have a very specific family relationship. And I put that in the chat in the Q&A. Unfortunately, it does mean, for example, that friends of the family, for example, cannot claim the child, even though they care for the child for more than half the year. It has to be a child, a stepchild, an adopted child is considered the own child. It can be a foster child placed by a court or anybody with a legal guardianship. It doesn't have to be part of the child welfare system. It can be a brother, a sister, stepbrother, stepsister, and then descendants of any of these. So nieces, nephews, grandchildren, great-grandchildren. Legal custody is not the test. The test is whether you have this relationship and whether the child lived with you for 6 months and a day. And I think that sometimes is not understood. And I'm going to go ahead and answer the question from Genevieve in the chat. A legal guardianship will be one that was actually approved by a court. So there will be a court document giving the person legal guardianship. It might be as a result of the child welfare system where they either got the child as a foster child or a legal guardian, but it also could be the parents died and the aunt got legal guardianship and it was approved by a court. But it could be a neighbor got legal guardianship and it was approved by a court and they'd have the relationship in that case, even though they don't have any of the other relationships.
Sure. Okay. And there are a couple questions in the chat as well, or in the Q&A that I can answer. I see Bernadette, you asked if what if a 17-year-old wants to know who claimed them because he didn't receive any child tax credits, so the credit would actually go to the adult. And I'm not sure if there's any way for them to track who is claiming them. I don't know, Deb, if you have an answer to that. And I'll just answer also your question on, can an 18-year-old claim the child tax credit? The 18-year-old can claim for a younger child that falls under the categories that Deb just went over, because you do age out at 17 for receiving the credit yourself. But an 18-year-old, if they have custody of a minor, they can claim the credit for them.
So the answer is, for anybody who filed to get the credit and was told they didn't get the credit because someone else claimed it, there is an IRS process where you can demonstrate that the child really lived with you for 6 months and a day and you're the one who should receive it. And I don't know whether that necessarily tells you who else got it, but if you can demonstrate that the child lived with you and you were their primary support for 6 months and a day, they'll give you the credit. And then it's up to the IRS whether they get the credit back from the other person. And we have information on our website somewhere about how you challenge it if you were denied the credit because someone else claimed it. That does happen a lot. Often both parents will claim the credit and the one who gets there first gets it, and then the other parent has to challenge it. But the IRS does have a process for challenging that.
So thanks, Deb. I see maybe someone can take the question from Wendy in the chat, and then we'll go over to Anita, who has raised their hand. But Wendy asked, what makes the CTC different than traditional tax credits in the past? I mean, I can just start by saying that what really was significant this year was not only that the amount increased, but that it became fully refundable and you needed no earned income in order to claim it. So often someone needs to have a certain amount of earned income in order to claim credit, or if they don't have any kind of tax burden, then they can't get that full amount of the of the credit. And so this really expanded it to folks who have no or very low income. But I don't know if any other panelists want to respond to that before we move on to our next question.
Sure, I'll add a little bit to it. So for the people we want to reach the most, it's these people who had little or no income and who can still get the entire credit. Whereas in the past, you had to have at least some income, and the amount of the credit you got grew as you had more income up to a certain point. That also means that it's typically people who don't pay taxes and don't understand that if they file a tax return, they can get the credit even though they don't owe any taxes. But the other two big differences was the increased amount of the credit and the fact that half the credit got paid out in advance payments in 2021 to the people that the IRS had records for from paying prior payments. That advance credit was really valuable. We know it greatly reduced hunger and housing instability and other issues for the families that received it. But the families that didn't historically pay taxes, that hadn't filed a tax return in 2019 or 2020, never got the advanced tax return, advanced tax credit, because the IRS had no idea where they lived or that they had an eligible child. And so those are the families we're really trying to work with you to reach, the families that don't routinely pay taxes, don't file tax forms, and the IRS had no idea that they were out there. The other thing is that even the families that got the advanced tax return, tax credit, have to file a tax return either through Get CTC or a full one in order to get the second half of the credit. So even if they got the advanced credit, they've still got to go ahead and file to get the second half.
Perfect.
So those are
Thanks,
the
Deb.
two things: higher credit, fully refundable even to people who hadn't, they get the full amount even if they didn't have any earned income, and the advanced credit. Those are the three
Perfect.
differences.
And so
Julie-
I see there's a good question for Monique in here, but I do, just to go in order, why don't we take it over to Anita, and then we'll pass it over to you, Monique, to answer a question in the chat.
Julia, just wanted to pop in. There was also another question from Laura. So if you want to answer Anita's and then Monique, and then I'll answer Laura's question that's also in the chat.
Perfect. So Anita, you can unmute if you'd like to ask a question.
Okay, yeah, thank you so much. This is very helpful. So I just have it's sort of a two-part question, not necessarily related. The first is, if you have to file a tax return where as before that you didn't to receive the tax credit, will other tax issues affect what you get? And then the second part is the test the test of whether you provided care for the child the 6 months, 1 day, meaning that if you, let's say, paid child support and for whatever period over 6 months and 1 day, is it the test that it's that lived with you and then provided care for at least 6 months and 1 day, I guess is what my question is. Thank you.
Thanks, Anita. I don't know, Deb or Alina, did one of you want to answer either of those questions?
I'm sorry, I was checking the chat questions. Can you repeat the first half and then the second half, and I'll try and answer them. What was the first part?
Can you hear me?
Yep.
So the first part is, if you have to file a tax return to get the credit, will any other issues that you may have with the IRS affect any amount that you should get back for the tax credit?
So the answer to that is, if you think you owe the IRS money from past years, you're still better off filing for 3 reasons. One is, a lot of people don't realize that the years where they thought they maybe owed taxes, they're actually due a refund because they were eligible for the earned income tax credit or other credits. The second reason is that if you owe the IRS money and you claim the credit now, you may not get the money refunded to you, but it will pay down your debt to the IRS. And that means you're better off, you're more able to get the benefit of future credits. And so it's always worth filing to clear it up. The IRS, isn't looking to go after you and claim the other back credits. They're really not, that's not their policy, and their website is pretty clear about it. I mean, if you were hiding hundreds of thousands of dollars of income, it would be a different story. But low income people who maybe didn't understand that they were due a refund, or maybe are having some of their money intercepted because they owe child support or college student loans or something, they're still better off claiming the credit so that they pay down those debts and can get the benefit of credits in future years. What was the second half?
Great. And so the second part is the test of the being able to claim the child, that child has to live with you. So let's say there's a parent that the child does live with, and then there's a parent that is not with the child that pays child support, let's say, and it does cover, care for that child. Are both eligible in this case? And then they would just whoever file first?
No. So if the child only lived with one person for more than 6 months, that's the parent that gets the credit, regardless of who pays child support. Where it gets complicated is if a couple lived together for 6 or 7 months and then they split up. And I don't know how the IRS handles it when the child lived with both people, but they're not, and they both try and claim the credit, but they're not, they're not a married couple filing a single return. But the IRS has a process where they resolve who's eligible to get the credit. And for a situation where one parent wasn't in the household but paid child support and the child lived in the household of the other parent, it's the place where the child actually lived, that's the adult or parent or other relationship who gets the child tax credit. There are some exceptions to whether the child has to physically live with you, like if they were in a hospital or away at school or things where you can still claim the credit because it counts as living with you. Your residence was still their home.
That's
Great.
great. Thank you so much.
Yeah, thanks for those questions, Anita, and for your responses, Deb. I do want to, because we're low on time, I want to go to Vanna's question, which was to Monique. I saw one of your challenges was identifying people who are eligible for the CTC, accounting for staff capacity limits. What was the most effective way for you to identify these people in your outreach efforts? Did you all rely on them to self-identify or through a survey? So Monique, if I can pass that to you, that would be great.
Sure. So yes, like just in general, like it's kind of hard to find people who qualify for the CTC. We just don't have enough information on who these people are. So just utilizing our My Chart and our pediatric active visit summary, we knew that that's a touch point where we can reach a lot of the adolescent population at one time by providing the information. So just providing the information in a very variation of ways, we hope that it would spread enough to these families so that they would know the credits that were available to them and that they would come in and schedule an appointment to get their taxes filed. But we never ask anyone to self-identify through a survey or anything of that nature.
Great, thanks, Monique. And I'll pass it over to Alini to answer, I think, Laura's question.
Sure. So Laura's question was, if a person with an ITIN files their 2021 return during the 2022 tax season to claim their US born child for the CTC, would they still get the 2021 CTC? They will if they had an ITIN before either expired or active before the end of the tax season this year. So if for any reason they didn't have an ITIN and didn't file an extension on their taxes for the 2021 tax season by April 18th of this year, if they didn't do any of those, they can't claim the credit anymore in the future. But if they have an ITIN expired or active and just didn't claim the credit, file a tax return for whatever reason, they can file a back tax return through tax season 2025 to get the 2021 expanded CTC. I also want to answer Steve's question here in the chat. Has there been any targeted outreach to SSI or SSD parents or who have minor children or Tanf households? We've done some of that. We've done some efforts through organizations like Generations United. So we did some national presentations on that. But we are always open to more presentations. We know that this is sort of like a niche community that perhaps might not be realizing that they can claim the credit or have concerns around claiming the credit. So if anyone out there is servicing these individuals and would like more information or training or anything like that, please feel free to reach out. We're happy to provide all the resources to help that community claim the credit.
And I think just to add to that as well, to Steve's question, and if Steve, maybe if you're also talking about kind of more general outreach, the Social Security Administration did do quite active outreach last year to families, like sending letters to families and emails and putting on a banner on their website. So we've seen really, really effective outreach when the Social Security Administration has done that and when agencies that provide Tanf with benefits have done this. So there are a lot of really great examples of agency outreach in that way. But as Alini said, there's a need for even more of that. So if anyone here does sort of have those connections with agencies or school districts or other major players, please do let us know through the form that we completed.
Yeah, I'll also emphasize it's really a state by state thing that's happening, especially with the public benefit agencies. So some states are doing more or less, depends on where in the country it is. So
perfect. So we're low on time here, so just a couple more. I saw that Roxy Keynes put an information into the chat, so thank you so much, Roxy, on IRS tiebreaker rules. And then I wanted to pass it over to Deb, who had a response to a chat.
So if you look in the chat, Kate Hansen did post an analysis by zip code that was actually done by the Tax Policy Center using IRS data, showing how many kids were at risk of missing the child tax credit. That is a really good tool for trying to figure out where a lot of kids might be at risk, but it's based on data before people could get the advanced credit or claim the 2021 one. It's based on, I think, 2020 filings or maybe 2019 and 2020. So it's good about telling you where you might have a lot of people at risk, but we don't have actual data about how many families did claim the credit so far. And I just wanted to flag that. And of course, thank Roxy for sharing the information about how the IRS decides who gets the credit when more than one person claim it.
So
and
I think, yeah, I was going to just say that I think we're at time, but I see one question we hadn't gotten to in the chat, so perhaps we can answer that. And then if people have other questions, please do email us. So I guess a final question here, if anyone, Monique, Deb, or Alini, want to take it. If someone has filed the 2021 tax return for the advanced tax credit, will they still need to file to claim the CTC, or will they receive both credits when they file at the same time? And Deb, I see that you're typing, so if you want to answer that live, that would be great.
Okay, I will stop typing and say, if people filed for the advanced credit and haven't gotten it yet, they should go ahead and file a return, because that'll give them the full credit. When they do that, there is an IRS website they can check to see whether the IRS thinks they received the credit. Maybe it got mailed to the wrong address or something. And if they didn't get the credit, they should go ahead and claim the full credit and say they didn't get it. In those situations, they may be better off working with a VITA site to help them process their claim, but they're always better off putting in the tax return for for tax year 2021 so that they can get the full credit, and then ironing out whether they got parts of the advanced credit or not. You don't want them to miss out on half the credit because there's just a dispute on the other half.
Great. So thank you all for such wonderful questions and for everyone's responses. I want to thank Monique, and I think Yesenia had to jump, but thank you both. We will share the slides, the recording, our guest speakers' emails, and our emails are here in the chat for any additional questions. So please do stay in touch. Let us know about the outreach you're doing, and we're so glad that you're able to do this outreach in your communities and programs. So thank you, everyone.
thank you, everyone.